Hi everybody, I am Dr. Harsha Kumar H N, working as a lead consultant nephrologist and transplant physician at Aster RV Hospital, JP Nagar, Bangalore. So today I am going to talk a bit about renal stone disease. So this is a common question what our patients ask. So renal stone disease is a very common thing which affects roughly around 1 to 3% of the adult population. Who are the patients who are more prone for renal stones? Those people who work in a very high temperature, those who don't drink water, those who are dehydrated, those who have family history of renal stone disease, and those who have got a very high uric acid. And these are the patients who are more prone for renal stone disease. So let's learn about what are different types of renal stone disease. See, the most common renal stone is calcium oxalate and calcium phosphate. They roughly contribute about 50% of the renal stones. This is followed by uric acid stones, which affects around 15% of the patients. And this is followed by calcium, magnesium, ammonium phosphate stones, which constitutes around 10 to 15%. And very rarely, if somebody has a genetic issues, they can get cystine stones and xanthine stones. They are very rare, and it contributes only 0.1 to 1% of the population. So what are the things that precipitate us for renal stone? As I told you, dehydration, not drinking adequate water. Okay. Second important thing that precipitate the stone is excess of salt intake, excess of junk food intake. Okay. And taking less potassium diet, especially if you don't take fruits and fruits very well, you are more prone for stones. And what are the risk factors, if you ask? Like somebody who has got hyperuricemia or gout, somebody who is obese, uncontrolled diabetes, somebody who has endocrine problems like hyperparathyroidism, where there is excess of production of the calcium. These are the things which can precipitate us for stone. What are the foods that can precipitate? See, excess of animal protein intake, which is beyond the level of the kidney to clear them. That animal proteins, excess of milk products, dairy products, and excess of the chocolate intakes, these all can precipitate us for the renal stones. So what are the foods we should avoid in patients who already have developed a stones? Once the black tea, excess of the chocolate intake, excess of junk food intakes, which is very rich in the sodium, which I told you, and excess of dairy milk products. Okay. Excess of over the counter taking calcium supplements without any indications. Okay. And spinaches, especially I want to highlight about excess of aerated drinks, because these are very high in oxalate, and all these can precipitate you for the stone formation. So next questions what our patient asks is, how to avoid the stones, doctor? So what I tell is, see, you have to take good fluid intake. Those who are prone for, at least normal people should take 2 to 2.5. Those who have past history of stones in the past, then they should take at least 3 liters of the water intake. Okay, they should take plenty of fruits. They should take a low salt diet. Avoid junk food, as I told you. Avoid high oxalate food, which I mentioned to you. Okay. And these things will help in a long run to avoid the stones. And because these are the, initially they form the crystals form stone. So if, and how frequently we should get our ultrasound done to look for the stones? See, somebody who has developed the stones in the past, like single stones or multiple stones, they need to get ultrasound after removal of the stones by any method. Okay, at least once a year they should get their ultrasound done. Make sure that you check your calcium, phosphorus, uric acid levels, and if you are already a gout patient, take your medications properly. By taking care of all these things, you can avoid the stones, and in long run you can lead a healthy life. So if you still have any queries with you, you can always contact me. I will be available at Aster RV Hospital, JP Nagar, Bangalore, daily from 10 a.m. to 4 a.m. from Monday to Saturday. Thank you.